Great. So right on time, and I believe it's 3 o'clock, and we can start. So here, I'm going to say a few opening remarks. So to all of you watching and to those of you in the panel, welcome to this World Humanitarian Forum webinar. Now, the World Humanitarian Forum is the largest and most inclusive nonpartisan forum in humanitarian aid and development. It emerged from the World Humanitarian Summit in Istanbul in 2016 and is now run by a social enterprise in London. And it sees itself as an international knowledge exchange, which brings us to today's topic, the COVID-19 pandemic and humanitarian action. Now, this pandemic is in the midst of exerting awful suffering and disruptive shocks to every corner of the globe. But in this, there is an opportunity. It's for the first time ever, a single unifying experience for all of humanity. But for the humanitarian system, for humanitarian action, I think it's a moment of reckoning. It's also an opportunity for transformative change. The question is, can we learn and adapt fast enough? And my name is Sean Lowrie. I'll be moderating today's session. I'm helping the World Humanitarian Forum think about its contribution today. And I've been in the humanitarian aid system now for 30 years. This month is my 30-year anniversary. And most recently, I led the creation of the START Network. Currently, I'm working in an emerging digital company called The Key that provides data and crisis management systems to organizations responding to the pandemic. And we've got a great panel today and a great discussion ahead. I'm curious about what challenges and opportunities you all see for humanitarian action in this pandemic, and what specific adaptations you are seeing and doing inside your organizations. So let's begin. Panelists, would you please share with us some opening thoughts, and begin please by just saying a bit about who you are and what you do. And we'll begin with Stephen O'Malley from UNOCHA.
Great. Well, thanks a lot, and a welcome to everybody who's joined us today. My name's Steve O'Malley. I am currently running the COVID team within UNOCHA. And I can't say I have as much experience as Sean, although when I think about it, I'm getting up there. I've primarily worked for the UN and then before that for MSF. Maybe just a few sort of overarching thoughts from our side. I mean, I think the real challenge for us, the central challenge is how much uncertainty we're dealing with. If you look at the scenarios or the different economic projections that come, whether formally out of the World Bank or in other sources, you can see this enormous breadth and the range of possibilities. So there's a huge amount of uncertainty, and that makes this situation very difficult to deal with, very difficult to plan for beyond a few months at a time. The other thing that we've experienced is, some of our standard response tools are not working in the way they used to, not working at all in some cases. And that is a function of the fact that people can't move in the way that they were once able to. We've seen some improvements in that more recently, but if our model has been dependent on moving people from place A to place B to assist with a response, and we are unable to do that, then we have to rethink that. And we've been doing some simulations, and we've also had some real-time experiences in Vanuatu and with Amphan, where I think we're still processing what the lessons are from those. We have seen a number of NGOs and UN agencies make initial shifts in programming, different things, for example, to try and put in place some social distancing measures or to improve water and sanitation in crowded communities, whether camps or other settings. But I think we're really still at the beginning of the changes that we're going to see in the way that we operate, and not least, as we'll come to in this discussion, in the balance of activities between local actors local civil society organizations, local non-governmental organizations, and international organizations of one shape or another. I think over, there's also a degree of concern that people have about the financial situation going forward, not just the economic conditions, but the question as to whether or not donors will continue to fund at the levels that they have been funding. We know well that a number of organizations were already in one form or another financial stress before COVID, and the question becomes, will that be even more exacerbated over time, and how will that affect the sort of partnerships that already exist? Finally, two other thoughts, I think, from our side that we're still working through. What do states do? What do governments do in response? And how could this change the way that they interact with the humanitarian community? Does this become a way to perhaps exert a greater degree of control or influence than in the past? And finally, in this gap, let's say, where you might have a different response from the international NGOs or from the UN agencies, more reliance on local capacities, does that mean we should expect to see a greater engagement from the private sector? And that, I think, is very much an open question. So those are just a few initial thoughts, Sean, and to get us going. Thank you.
Thank you, Stephen. Gabriella Waaijman from Save the Children. Did I pronounce your name right?
Waaijman.
Waaijman, sorry.
Okay. Thank you very much, Sean, and thanks, Steve, for those opening remarks. Very similar experiences for us in Save the Children. So basically, our entire response system is challenged in COVID. As Steve mentioned, the response system relies on surging people and goods and money to an affected area. But people can't move. There was a lot of competition over resources, particularly resources, of course, needed like personal protective equipment or otherwise. But also the money surge was an issue because the areas where we normally mobilize the money from has been heavily affected by COVID itself, and so a lot of our there's institutional donors, but there are, of course, also private donors in countries where we normally mobilize the money, where people are saying, well, instead of supporting Save the Children, I'm going to support my local church, or I'm going to support my local health services in this country. So we saw a huge stress on the system. And so very early on in the response, we had to shift the way we work around quite dramatically. So we basically built our response on sort of like the magic four, I would call it. First and foremost, 4 steps. So and those 4 steps are staff health and safety first, business continuity second, program adaptation third, and answering the question what more we can do comes fourth. So we told our country offices, don't try to start answering the question what more we can do to respond to COVID unless you can answer the question, how can I keep my staff safe? How can I keep my business running? And how can I make sure that the programs that are already running, that are already saving lives, can continue safely? Because it is that footprint, it is that capacity that we have, that is our springboard from which we can maybe do more. But we need to protect and preserve that first. So that was the first magic 4. We then developed a response program around 4 pillars. The first one is the survive pillar, so that's very much the health pillar, but also nutrition. The second one is around education. We have more than 1 billion children out of school globally. So we needed to make a huge investment on how do we provide alternative education when kids can't actually go to school. So a lot of investment went into that. Protection was the third big pillar because, of course, the protection concerns have gone up dramatically, as we all know, in the current situation. And the last one is in anticipation of secondary effect of COVID, which is that family finances are going to be compromised globally. So this is not just in the global south, but this is also here in countries where we would normally mobilize money. So those are the 4 pillars of our response. And then we had 4 enablers to the response. Accountability to affected populations, first and very much so. Secondly, we've got to coordinate. This is so big. You know, normally we say in an emergency response, you can't solve it alone. This one, definitely not. So we've got to coordinate. We've got to work closer with our local partners, but not use them as our implementing instrument. They're not our implementing instrument. They are our partners, and we need to treat them and make sure that we treat them as our partners. So what about their staff health and safety? What about their overhead costs? What about their needs to adapt their programming? All these things cost money. So we need to support them in that. And last but not least, we need to be a learning organization. None of us have the answers in this response. So we've got to be learning as we're doing, and we've got to share those lessons with each other. So very early on, we put a system in place for self-reliance for our countries. We put a flexible fund in play globally that country offices could access to support their staff health and safety, things like that. We have a global learning platform for capacity building for our own staff that we run on Kaya. And we very quickly put a COVID learning pathway on Kaya. How do we, you know, using that technology, support the training of more community health workers to go out in the community, for example. We strongly coordinated with the global response plan led by Steve to make sure that we are integrated with that. We are using our education co-lead position to make sure that national partners have a seat on the table, and also to strengthen accountability to affected populations. And obviously for the 4 pillars, we try to mobilize some money, but as Steve was mentioning, money is not trickling down to the front line. And I think that is a huge constraint and a huge concern for all of us. At the moment, there is no money. So there's money somewhere in the system. There's a lot of pledges that have been made, but if you look at the front line, we don't see it. And that's a huge issue, and that's going to neck us all. At the moment, there's a huge vacuum, and that has got to be addressed. So what does this mean? You know, we have all of this, all of these constraints. We have very little money. So it's a huge shock to the system. It's a shock to all of us. Maybe there will be a more direct relationship between UN agencies and local partners. And maybe us international partners would have to find a different way of engaging with the system, or maybe quite a number of them will, not be able to respond anymore in the absence of funding. But I think we need to, and this I'm gonna end on an unfinished thought. But I think we need to very carefully watch the potential unintended consequences of some of this. And what has pained me in some of the localization debates is that we have been pitted against each other as international NGOs and local NGOs. I just came from a meeting where one of our local Save the Children offices said, and this is our India office. So they said, we are neither seen as an international NGO, and we're not seen as a national NGO, and we're not seen as a local NGO. So we don't fit anywhere anymore. I find that rather condescending to start with. So if we have a footprint in the UK, then it's okay, then we're part of a system. But if we have an equal footprint in India, then we have to define what that footprint particularly is, and why is that not a local NGO or a local or a national NGO, right? So there's issues there. And we have been pivoted against each other over money, rather than looking at what combines us as civil society, what values we have in common as civil society, national civil society, local civil society, international civil society, and the values that drive us that are different from the political values that are pushed through governmental or intergovernmental systems. So I think that's the last unfinished thought that I'll end on. Thank you.
Excellent. Thank you, Gabriella. And I didn't thank you, Steve, as well. Very, very good opening framing comments. Let's keep going. Jonathan, Jonathan Brooker from Solidarites UK, please. Oh, you're plopped back on mute again.
How's that?
Perfect.
I made that classic mistake, didn't I? Thanks very much, Sean, and thanks, Steve and Gabriella, for those opening remarks. I suppose I can just say I could not possibly agree more with some of what Gabriella has just described as some of the challenges and missed opportunities, actually, of linking up civil society organizations working internationally and nationally. But I was looking at this and I was thinking, you know, the title is Leaving No One Behind here. And I've been asking myself quite seriously the question, well, have we been able to respond to the pandemic leaving no one behind? And you know, the answer to that question for me is quite clearly no, we haven't. And there's multiple reasons as to why. And I think a lot of the reasons why have kind of reared their head in a very, very extreme situation, which is of a scale that we have never really seen before. So I think we've, as organizations, I can certainly say from Solidarity's perspective, yeah, being under stress, faced some serious challenges in terms of staff management, team management, deployment, accessing the field, accessing or managing log chains and all those sort of quite technical points have really meant that operating has not been easy. And we've also noticed that with a number of organizations that we partner with and that work around us as well, they have faced similar challenges, even to a greater degree than we have. So to some extent, we all also feel quite lucky that somehow the very nature of our architecture has managed to continue operating, not 100%, but to a degree where we still have been able to actually respond. In saying that, I feel there's been a number of problems overarchingly, which have been driven by distractions, leading to confusion, kind of leadership challenges around the overall response, with a lot of preoccupations, which have created obstacles. So what I mean by that is when we first really kind of pushed the button as the humanitarian ecosystem, it was really important to focus on time-sensitive and critical response actions. But very, very quickly, a lot of the key messaging and advocacy for guiding resource allocation towards some of those things, activities in the health sector, activities related to infectious disease prevention and control, social communication around barrier behavior, etc., got lost because of a lot of big voices in the system sticking their hand up and saying, don't forget about this, don't forget about this, don't forget about this. And in the end, we didn't prioritize key and critical time-sensitive issues early on. We also ended up in a bit of a situation where we went into autopilot as a system. A lot of leadership gets quite preoccupied about when there's a crisis, you have to be part of the response. And actually, for a lot of organizations, there could have been a bit more self-awareness and discipline to put your hand up and to say, actually, we're not best positioned right now to be part of this response. We need to step back and allow space for organizations that are much better positioned to be able to access the resources so that they So you ended up, in fact, having a lot of organizations coming forward which were not really experienced, not specialized, didn't have any experience or haven't had any experience in infectious disease outbreak control, coming to the forefront. And I think that has ended up in this situation where we've got obstacles, much like Gabriella just said, where there has been money going into a system, but it isn't getting to the front line. And there have been attempts to try and deal with that. I reference, for example, the START network and the COVID-19 response fund. That is a mechanism directly set up to get money from donor to delivery incredibly quickly, quicker than any other mechanism I've seen in the entire system. And yet it didn't get the support that it needed. There were, I think, 80 odd different alerts raised across the globe in 65 different countries, with member organizations saying, we can do the work we need to do now if we get the resources to do it. But instead, resources tended to come slowly and channeled through quite quite administratively big and complex pre-existing mechanisms. I think the final point, sorry, I might have gone on a little long there, Sean, but just to say, for us, we also look at this pandemic and we say, this is not a freak incident. It's not an anomaly. This has happened as a result of the fragilities and weaknesses, underlying problems that exist in the world in terms of global public health, in terms of socioeconomic systems that are in place, governance, trade, interconnectedness between countries, ecological issues, environmental issues, social exclusion issues, and it's not going away. So this can happen again soon, actually, because we're not dealing with the underlying fragilities that enable something like this pandemic outbreak to spread and have the impact that it has had to such a great degree. Thank you.
Great, thanks, Jonathan. Again, super helpful to begin. Mihir, what do you think about this?
Thank you. I must be very bold to be in this panel because such large and well-established organizations, and we are very small, All India Disaster Mitigation Institute, and very local, based in Ahmedabad, working across several states and cities of India and in the neighborhood in Asia Pacific. And we are an action and learning organization doing, actually responding, but also learning from that, and mainly focusing on what one would in a sentence say, missing voice or a missing view. That is not. So let me share the missing view that we haven't presented here so far, after the excellent overview that Steve and Gabriella, you and Jonathan, you gave us. So I'm not repeating some of the major concerns you have. I thought maybe instead of looking at concerns, I'll give a view of some of the opportunities from this particular vintage point one sees. And 3 minutes, so maybe 3 opportunities to start with. One is feeling very concerned about the whole COVID response has been by national governments in most cases turned into what is called a medical response, which means testing and data about the testing and ventilators and of course ICUs and so on and so forth. And of course they are needed to save the life and there has to be a medical response to do that. But that is not all. And the opportunity lies in this response is actually turning this response into a holistic health response where we are looking at something, Gabriella, you mentioned about nutrition and food, for example, and health education, for example. So these sort of silos of dividing health into only medical care is actually not really needed, while the work on testing and work on virus prevention is being done. So that is one opportunity to turn COVID into a holistic health response. The second opportunity I find from the work that we do, and we'll talk about that later as well, is about this whole national approach in many countries, perhaps not all, but I think in many countries is very much sort of command and control. And that's not very humanitarian at all, to command and control. We do that sometimes, sadly, but we quickly become aware of that and try not to do that. And which is very sort of top down. And there are announcements to close down, lockdown, social distancing, so on and so forth. It's very institutional approach, as if institutions make up our society alone. It's very sectoral as well. And the opportunity there lies, and one sees a lot of interesting work being done locally, is to make the response more about care and nurturing. And you see a large number of organizations, small ones, of course, but large number actually doing that. And not in thousands, but in terms of lakhs in Indian millions, if you will, that is happening. And that's a huge opportunity that we see this actually happening in India, in South Asia, Bangladesh, for example, Sri Lanka, a lot, Singapore even more so, even Korea one saw that. So that's the second opportunity that, that one sees. And the third opportunity is, which in fact all three of you described the part of it, how you sort of receded to let things happen. And that is, I would like to mention that as making humanitarian action work with less. But what is it that is minimum? Sort of simplicity of doing humanitarian action, if you will, sort of the essentials of humanitarian action, if you will. And what is it that, and that is a whole opportunity for us, that we can do all these things and we can do it with less, and we can do more with less. And that's a third opportunity I see happening at a local level throughout many locations, both in India, but also in the surrounding countries, and not so far, not so close, but far of surrounding countries as well. Thank you, Jonathan. Thank you.
Thank you very much, Mihir. Okay, that was great opening round, and I think we've portrayed a bit of the picture. I mean, we could go in a number of different directions here, but maybe one thing that we could try is to think about what, you know, if there are travel bans that are preventing international staff from traveling, if there are resource shortages that are preventing traditional support from flowing, but there are things that we can do, and I'm just wondering what sorts of examples do you have, maybe in the digital technology area, for supporting people at the front line, or here I would love to hear more about the care and nurturing approach that you mentioned just a minute ago too. What does that actually look like? Maybe just some examples that we can think about.
Sure, thank you. And you know, as AIDMI, we've always responded differently, being an action learning organization. And each time there is a new theme. And this time we thought, let's look at localization, but let's localization in terms of, does anybody need us? We are there locally, but you know, does anybody ask us to actually help? And so one assumes that because one is doing humanitarian work, one has the right to move on and do things. And that was a very risky thing to do, but you know, we didn't hear from anybody for a while, and it's days and week and a half, and we did one or two, and then feel, you know, we're extremely busy right now. And what kind of people we heard with is very, very different than what we thought we would hear from, where this care and nurturing part that I mentioned before is happening. And we've heard from street vendors unions, for example, who sell vegetables and fruits on the streets, and how we can help them with their own business continuity, their own staff protection. We've heard from federations of farmers, family farmers in various districts and countries across Asia Pacific, that how they can design what the farm, I mean, you can't lock down a farm. You know, it's impossible. So what do they do? And then you have the farm labor, and what do you do with them? How do you socially distance with them? So that kind of caring and nurturing part kind of request has come. School boards, Gabriella, for example. All of a sudden this happened, and that's been closed down. And what to do with your students, your unfinished education and exams and so on and so forth. And you sort of hear from the municipal staff of the city municipalities that, you know, we need to respond as a city, but whether we don't have the wherewithals even to collect data, Sean, that you were talking about. So how do we actually collect that kind of data at this level? So that's sort of one major aspect of doing it. Second is we decided to one-to-one. I think there is this, you know, obviously there is what is called economy of scale. And, you know, we've enjoyed that and we've seen how it works. And we thought here is a chance to do one-to-one. And is it possible to actually do that? Of course, we are very small, but it is possible to one-to-one and not have a project, not have a program, but treat each individual demanding your services, support as distinctly individual request. I hate to use that word, but just to give an idea, sort of a boutique approach that we will respond to you as only and special client or special request. And how will it actually work? So it sort of became a retail humanitarian action, if you will, not a wholesale, but a retail humanitarian action. And that's something possible to do, we realized, locally at least. And also within that, what we found, that not only what Schumacher said, small is beautiful, but also small is humane. And that's something one actually sees, that you can do small things and they add up to a large, fairly large, effective, humane sort of way of doing things. And last is to, the way to do that we found is the demand which came from this federations and builders and migrant workers in Indian case a lot, and we'll talk about that later, I hope, was sort of the following areas. One, they wanted to set the agenda. It was so confusing because everybody affected in every way. So how do you set agenda? And there was a need for that, and we helped them do that. Second, they wanted to know how do you sort of build capabilities. Capacities were out of question, there was no money. So that part. And third, the pilots, that, before we jump into something major, how do you sort of do the small pilots? The last two were very interesting. And a lot of that was about reconfiguring the work that they were doing. So Gabriella, you described that, your sort of third point of the 4 point, that how do you reconfigure what you're already doing slightly differently, rearrange that, reprioritize that, so that it becomes a more effective humanitarian action. And the last one is co-creating. That, look, we don't know how to go about it, you don't know, but if we are together, we can actually have a co-created humanitarian response. So what happened was that, small is humane, small can co-create, and small can also reconfigure. And I think that's perhaps more to look for in the coming months and probably longer as well. Thank you.
Oh, wow, that's super interesting, Mihir. It reminds me of people advocating for bringing resources to a crisis zone in the pre-COVID days, and looking for people who are responding, and then providing them with resources rather than coming with a predetermined program in any way. And the scale and disruptive power of this pandemic shaken all of our routines. And so the only thing we can do is learn from a position of humility. And I really find it interesting the way AIDMI, it must have been very nerve-wracking to sit back for several days and wait for people to come to you.
We were talking as the close down shop and lock down and lock out. But it actually works. It actually works. And I'm so glad that we were able to now prove that there is a need for local. Thank you.
Jonathan, did you want to say?
Yeah, I did actually. I think just on you raised the point about the challenges of deployment and having sort of travel restrictions, etc. I just wanted to say I think a lot of institutions inside the sector, but also in the business world, kind of made an automatic and quite quick switch to sort of teleworking models, etc. But actually, we also certainly internally place a huge amount of value on the notion of having the right people in the right place at the right time, and that's particularly important when we're sort of dealing with oversight of IPC responses in terms of experienced technical expertise in situ. So fairly early on, we started in France having a conversation with the French Ministry of Foreign Affairs, and explained that it was very, very challenging for us to be able to get those right people in the right place quickly. And they were amazingly facilitative, it has to be said, and essentially helped us organize to set up a European-based humanitarian air bridge, which then the EU has supported. So that's what dealt with some of the logistical challenges of actually getting passengers on planes to get to certain locations. So already there have been flights facilitated which have gone to CAR, DRC. Coming up is Afghanistan, Sudan, South Sudan, Burkina Faso, Venezuela, Nigeria, Iraq. So we connected with a lot of other partners, NGO partners, mainly I have to say with headquarters in France, so the MDMs, the MSFs, the ACFs, etc. And also were able to coordinate to make sure that all of us could get people deploying, particularly in some of the very, very complex places that we work. Northern Nigeria, for example, that really requires an awful lot of operational sensibility in how you're working there if you're not going to face serious challenges. So just wanted to say, it's not always the case that we just automatically say, well, we just can't do it, so we leave it alone. In that instance, we just reached out and blitzed and coordinated, and in the end, found this solution that the French Ministry of Foreign Affairs has been very, very helpful in supporting to get people that we really needed deployed actually out there logistically, but then also helping with a sort of diplomatic level in terms of visa facilitation, which we just would not have the clout, power, connections to do alone. So that has made an enormous difference in our ability to respond in operational capacity.
So some quick thinking and agility, I think, is clearly needed when you're trying to get something done in this kind of ground shifting crisis. Jonathan, can I come back to you and ask you another question? Because you had said in a previous conversation that your organization is also responding in France and in United Kingdom. I'm just wondering what sorts of things you're doing.
So in France, so for us, it's really not, it's well outside our normal parameters. We operate in 17 different countries across the globe, which are mainly in Africa, the Middle East, and Asia. But it became very, very apparent very quickly that there were communities being left behind actually in France, particularly in some of the sort of informal camp areas, a lot of sort of migrant populations. And at sort of headquarters level, the decision was made, we have to do something about this. It's completely outside of our normal framework, but people don't have access to a lot of the different materials that they're being told to use. So it's all well and good having public messaging to say, make sure you're washing your hands all the time and make sure that you can protect yourself and don't go out shopping, etc., etc. But if people don't have the opportunities to do those things, it's fairly meaningless. So we started to provide safe drinking water with temporary bladders and all those sorts of things, soap, hygiene materials, a lot of the things that you would actually see in a lot of the countries that we're more used to operating in France. And then also in the UK, we through linking with the Foreign and Commonwealth Office, we were informed that the Vietnamese government wanted to donate PPE to the UK, particularly to frontline healthcare workers, but the FCO doesn't have a mechanism in place to do that. So through the Global Logistics Cluster, we ended up having them reach out to us, and they asked, can you receive and then distribute and do some of this work. So again, completely outside the sort of normal parameters, but exceptional times call for sort of exceptional and different ways of operating, and we just adapted to be able to do that. In fact, we have another 50,000 face masks coming in today.
Fascinating. Gabriella, you had mentioned also that you were getting requests from UK charities for help. Can you say a little bit more about the types of requests you're getting and the types of things that you're doing in the UK? And the reason I'm asking, I don't want to fixate on the UK just because you and I happen to be there right now, but it's about how a humanitarian organization can adapt to a very different crisis and how we can establish legitimacy by responding to need around us. And I think it's very important for us to reflect on this.
Yeah. So for starters, Save the Children, of course, is a global organization and has had long-running programs in places like the UK, the US, and other places, Denmark, you name it. So we work in 120 countries, including in high-income countries. So these domestic programs have been responding to COVID the same way, and like Jonathan is saying, the same way as our countries elsewhere in the world have been responding. A lot of learning has taken place from the global south to the global north, because where a lot of our countries in the global south are used to rolling out a public health response in no time when there is a threat. Our countries in the global north are not so much used to it. They rely on a strong, medical response system. So they were overwhelmed here. And there were a lot of lessons that were applicable from the global south to the global north. So that was good to see. But then we also had quite a number of colleagues in organizations that we normally work with in the UK or elsewhere, who said, we're not so used to doing emergency response. And so we feel adrift. We don't know what to do. Our mandate, or the reason for our organization's existence, has been that priority no longer exists. So we don't know what to do now. And can you help us adapt? Because we feel we can be useful in this society, but we're in shock. So we've provided some support to some organizations as well to help them manage through emergencies. So yeah, that's is adaptation, I guess, in action. I wanted also, Sean, if I may actually respond to one of the comments that I saw come through from Ashok in the Q&A section. Because he said that we're in a world where we're increasingly divided on the basis of race and religion. Maybe the humanitarian agenda can be an agenda for action, because it's the agenda of international solidarity that combines us. And I wanted to thank you for that, Ashok, because I think that's a really important comment. Whenever I felt down or in despair in these last couple of months that we've been working, the one thing that gives me enormous amounts of energy is the fact that we have people all over the world who believe in a similar cause. So when we are indeed feeling down because we think that the world is becoming more polarized and more selfish, at the same time you see tremendous acts of selflessness. And so when I see that some of the Save the Children staff in DR Congo want the same thing for children as a colleague who in the Isle of Wight in England is really frustrated that she can't go out canvassing on the street anymore because of COVID, and can't wait to get back to work to help children everywhere all over the world, then to me that is a really powerful part of the movement, and that is what we really need to preserve, because that's where the solutions are going to come from.
Interesting. Thank you. It's a great direction to go in. And Steve, it leads me naturally to ask you about how you see things from the UN. I mean, UN was founded in the period of post-World War II. One could argue that this is the crumbling of the post-World War II era. Yet, the humanitarian system was created in a world that no longer exists. And yet we need to work together more than ever. And if the UN didn't exist, we'd need to create it again. And you're under tremendous pressure. Secretary General is exerting great moral leadership and calling for global ceasefires, among other things. And I'm just wondering how are you seeing the challenges for those of us who are trying to get the world to work together to solve these problems?
Yeah, I mean, I think, Sean,
a more positive way of phrasing it,
Yeah, no, look, I think there's no shortage of challenges. And I mean, I think if you look at what the Secretary General has been trying to do over the last few months, framing these different issues, not just the global call for ceasefire, but also the report that just came out, the policy document that just came out on people on the move, refugees, IDPs, and migrants, previous pieces on children, on women. I mean, it really is an effort to shape the discussion around some of these things, and also to say, well, what, not just, well, here are the, the risks, but what are some of the things that can be done effectively? What are some of the policy choices? I mean, this is, I think, always for me, a very important piece of this, of any one of these discussions, and whether it's, whether you're talking about individuals or communities, states, I mean, there is agency. There is the ability to act. There are policy choices that are being made all the time. And, we did some research last week looking at actually identifying the good policy choices that are being made by individual communities, individual subnational units, et cetera. I mean, the Indian case is full of excellent examples of states acting in particular ways. So, I think, first of all, that for me is to never, is to always keep that agency that, that people have in the forefront. Second, I think, we have put together collectively between the UN agencies and the NGOs, I think, a fairly solid piece of work in the Global Humanitarian Response Plan. And, you saw the initial funding support to that came in. We were able to stand up this logistical backbone run by WFP, and then a set of 3 purchasing consortiums for PPEs, for diagnostics, for medical equipment run by WHO, but with a lot of input from other parts of the UN system and from some of the key medical NGOs. So, there are things that are being done, notwithstanding those kind of, geopolitical challenges, if you want to call them that. I think it's useful for us to also recognize that as we called it internally, that second story about the other things that are going on.
Great. Again, there's so many things we could talk about, but we're running out of time, and I would like to give you all one last chance for some concluding remarks. And while you were thinking about that, let me just say that it's, the humanitarian aid system really largely comes from that era after World War II, when we had this common tragedy that united everybody around the need for creating institutions that would promote peace and steward our future. And those institutions have performed admirably over the decades, and now we're challenged by the first crisis that we all are experiencing at the same time, and at the same time it's a post-truth era. So can our institutions adapt to a post-truth era, and what would the purpose of humanitarian action be in a post-truth era? If we wanted to prevent wars after World War II, what are we trying to prevent now in a post-COVID, post-truth era? It makes me feel that there is a lot of there's a big contribution, a big need for the humanitarian system in helping promote solidarity, as you said, Gabriella, and others, in reminding everybody that there is kindness in human nature through the act of humanitarian action, by standing back and waiting to hear from trade or unions and offering help. It shows there's kindness in human nature, and that fights against the forces of division that would make the world less safe for our children, not more safe. So I hope that's given you some time to think about what you would like to say in conclusion. Who would like to go first? Gabriella, please.
Sure. No, thank you for that, Sean. And I think that's exactly, for me, one of the key things. I hope that the humanitarian endeavor of the future is about equity, and it's about international solidarity, and it's about rights. Ultimately, we need to go back to a rights-based approach. But in it's like the thought that's going through my head at the moment is that the past few weeks or the last 2 months, we've been all working like mad. And it feels like the first wave of the tsunami has come through. But that has only been to prepare us as best as we can possibly be prepared for what is still to come. And what is still to come is, COVID hasn't really hit yet in some parts of the world. And in some of the more fragile parts of the world, that can get really scary. I mean, if Yemen is anything to go by, we should be really, really worried at this point in time. But it's not only about the disease. And I see some of the comments on the sidelines. So there is also Ahmad who is saying, I'm jobless. Guys, what are you doing to create jobs? And I think that is the massive second wave of the tsunami that is going to come our way. A lot of people have lost their jobs. A lot of people have lost their livelihoods. In 2017, we had 4 countries that were at risk of famine. WFP is now warning us that potentially 11 countries can be at risk of famine. Absolutely unprecedented. So we have food security issues, we've got economic issues. That's the second wave. And the only way we can get out of it as a humanity is if we stand together. So I hope that's what the humanitarian endeavor will, you know, if it survives COVID, that is what it will stand for. Thank you.
Thank you, Gabriella. Who would like to go next?
Well, maybe I could just say, I mean, I think I'm very much in agreement with Gabriella's thinking, and particularly keeping this focus on rights and on people, because it is one of those Gabriella referenced, used the word tsunami, and sometimes these events can become so overwhelming that you lose the focus on individuals and on people. And I particularly appreciate Mihir's thoughts in that regard. That's very much what we have to do. I think also that what we've seen in other health crises, let's say, is that the effects, Ebola being a very good example of this, the effort to deal with a crisis like that tends to weaken essential health systems and tends to create increased need for people. In fact, the weakening of those health systems becomes more deadly to people than the disease itself. And that's something I think we very much collectively have to work against, that we keep our focus where it needs to be on what people need, and that is not just protection from COVID, but it's a wider range of things. I think that's going to be very important for us to do collectively. Thank you.
Thanks, Steve. Jonathan, Mihir?
Yeah, I suppose couldn't agree more, really, with sentiments from Gabriella and Steve. I think a big underlying point is really this recognition that this is not a freak incident. This is not an anomaly. It is the result of an unstable world, that as it becomes more unequal, it gets more unstable. And for sure, prevention is better than cure. And the only way that we can create an environment where there is reduced risks of the pandemics is to strengthen civil society. And through doing that, you will increase resilience. You will be able to empower people to improve the state of global public health. You'll have stronger socioeconomic systems, safer living environments, and that second wave, I think Steve described, around joblessness, homelessness, poverty, etc., being, of course, exacerbated in the context of a pandemic. There'll be more resistance to that, because there'll be more opportunities for people to be able to cope. At the moment, there are huge proportions of global society that have simply run out of any type of dignified coping mechanism. They no longer exist. It's too fragile for them. And unless that is addressed, this problem will come up again, and each time it will get worse and worse.
Thanks, Jonathan.
Sorry.
Mihir, can
Yes,
you
and this is last. We are concluding, and how quickly time flies. Yaqub Bhai, you had a chat in your question about employment, and that's something I'd like to underline very much. And picking up from what Gabriella, you and Steve said, the rights-based approach. And I think a universal right to universal basic relief that we all agree to. Universally agreed basic relief, irrespective of where we actually respond, would be really something wonderful to have. And that's your answer, Yaqub Bhai, that jobs relief is not only in terms of relief money, but basic income, basic livelihoods, basic ownership of assets. So that's one part I'd like to see happen. The second part, something as concrete as that, is a right to social protection, especially children, but also women, and also the laborers, migrants, displaced. And that's something which very much would be good to see if pandemic influences the humanitarian system as much as we can. The third is the direct focus, which the humanitarian system hasn't, on the displaced population. May it be migrant workers, as in India, we saw millions and millions and millions, but also in South Asia, Bangladesh and Nepal and Sri Lanka and many other countries. So how do you, the overlap between displaced population and migrant population? In Europe also, you have the unrecorded migrant workers. They are visiting, they've stayed on, overstayed, a whole range of that. And that's something humanitarian system needs to address that. I'd like to suggest two short, much larger issues, and that is that whole humanitarian response and therefore action that we are talking about is based in a very neoliberal economics. And we are seeing the limits of the neoliberal economics. It's not quite working out. There are lots of good parts of that and achievements, but it's not quite working out. So what kind of economics within which this humanitarian sector or humanitarian system can work better? And let's look at concretely, for example, Singapore gives one example. I'm told Norway and Sweden has given some example as well. I'm not so sure about that. It's a bit far off. Something very close in Kerala in India, and the Kerala state government decided that they will follow the humanitarian response. What they very clearly and in a detailed way articulated is a moral economy. That can we have a moral economy where it's not demand and supply, but it is what is it that's the right thing to do and how economics can work around that. If you have 1 million migrant worker in the state, what's the moral imperative? What's the humanitarian imperative? We must feed them, shelter them, and do that. So I think sort of rethinking the humanitarian system into beyond neoliberal aspects. So that would be something very important to look at. And the last one is to look at, see that how the humanitarian system can be a catalytic force and not instrumentality, not performing, not a system that works efficiently, but the system that actually transforms and sort of plays a catalytic role to move us ahead, to start with Steve, with the SDGs, but also far, far beyond that, where every child that is born has actually a better future than what we have had in the past. So sort of the catalytic role of the humanitarian system that we may want to look at. And the best way to do that is perhaps to look at take the state of the humanitarian system that we know very well and see that what is the state of the humanitarian system's performance. That if that is the state, how the performance of the system has taken place during COVID. And that would be something so great for all of us to look together and see that how have we performed. And I'm sure we've failed and we've not done very well and we've done mildly well and some things we've done very well. But that would be such a good thing for World Humanitarian Forum to actually take forward from what we have discussed here. But how have we performed subsequently? Thank you very much. Thank you.
Thank you, Mihir Bhatt from AIDMI India. That was fabulous, a fabulous way to conclude. You know, the word that's resonating in my mind is, as we draw to the end of this webinar, is agency. We do have agency. We have moral authority and we have agency. We have relationships around the world and we have a mandate that we can. Moral authority might be strong, but we have a mandate at least, and we have relationships around the world. I think that there's a lot that the humanitarian system can do, and I think that you've made a really important point, Mihir, about the neoliberal economic model. You know, we've been driven too much by money. We've been reacting too much by events, and now we have an opportunity. Let's see if we can capture it or capitalize upon it. So thank you very much. It's been great to meet you and to talk with you today. We certainly could have talked longer than an hour, and maybe we'll get a chance to continue the conversation again.
Yes.
Thank you. Bye for now.
Thanks very much.
Thank you so much, all of you.
Bye.